The government has been accused of being slow, inconsistent and at times negligent in their approach to social care during the COVID-19 pandemic.
A Commons report also describes advice to hospitals to discharge thousands of patients into care homes without knowing if they had coronavirus as reckless and appalling. Throughout the lockdown, the government frequently defended their approach to care homes.
We brought the lockdown in care homes ahead of the general lockdown.
Right from the start, we've tried to throw a protective ring around our care homes.
We absolutely did throw a protective ring around social care, and I'm glad we've been able to protect the majority of homes, and we'll keep working to strengthen the protective ring that we've cast around all our care homes.
So they claim to be casting a protective ring around our care homes. That would be seemingly dismissed by this report that's out today. We're joined from East London by the Labour MP Meg Hillier, Chair of the Public Accounts Committee, who have published this report. From North London, we are joined by the Conservative Life, Peer and Social Care expert, Baroness Altman. From Bristol, we have former Liberal Democrat Pensions Minister Steve Webb, and in West Yorkshire, David Crabtree, who is the owner of 2 care homes. If we can start with you, Meg Hillier, thank you for joining us this morning. I mean, the report itself is pretty damning with regards to the response of the government. When you hear Matt Hancock and Boris Johnson claiming to have cast a protective ring around the care homes in response to COVID, what's your reaction?
Well, you know, that sort of bravado is nonsense, and it's really important that we have some honesty about this. The Permanent Secretary, the head of the department, recognised that they did what they could at the time, but recognised it hadn't gone perfectly. That's a more honest approach. And, you know, the impact of this decision was devastating for a lot of care homes and obviously a lot of people who lost their lives.
Why did they get it so wrong? How did they get it so wrong, Meg Hillier?
Well, one of the things we've looked at generally across the board in this report and in others is how government prepared for this pandemic, which is the top non-malicious risk that government has to prepare for. And it focused very much on health. And of course, in pandemic, it's absolutely right. They looked at the capacity of the NHS. We wouldn't criticise that approach. But in doing that, they didn't think about the knock-on effects, the consequences of those decisions. So to discharge people who were medically fit, and we pushed and said, well, does that mean they were tested for COVID? And no, they didn't think that was necessary. And yet we knew that schools are a potential risk in any pandemic, in this case perhaps less so, but usually that they're spreaders. So you know when you put people together, there's an issue about spreading. So these should have been modelled and thought through in advance. But crucially, when they realised there was a problem, they needed to act faster, and they didn't.
Baroness Altman, coming to you because you're a social care expert. I mean, this was an unprecedented event, wasn't it, that the government was faced with? But do you think that there were issues that have been going back for, you know, years and years that meant that it was even harder for them to deal with this effectively?
Well, Charlotte, I think you're absolutely right there. This is a crisis that has been building up for years, and what has happened in care homes is a tragedy, but it's also one that we have to learn lessons from, because it's the result of the way we organise what we call social care. And the care of elderly people seems, and the disabled, seems to not count in the same way as we would expect service in the National Health Service. So in the early stages, even though we knew that the frailest elderly people were the most vulnerable to this illness, somehow the aim of protecting the NHS overtook the aim of protecting the lives of these people most vulnerable. And we knew where they were. They were in care homes. The problem is that social care is run completely separately from the National Health Service, as if somehow when you're caring for people who can't look after themselves and can't live independently, it's not about health or care. Well, it is about health and it is about care. And I think we need to learn the lessons that we have to look at social care integrated with the NHS on the same sort of parity of esteem.
David Crabtree, you own 2 care homes yourself. You're there in West Yorkshire. What's the experience been for you, your residents and your staff during the pandemic?
Good morning. I was just discussing, our staff were devastated because, unlike hospital, though our residents are not this week's patients. We've cared for some of these individuals for 2 or 3 years at a time. And to come into work and over a 10-day period lose 8 of the residents day in, day out, where, yes, they were elderly, but these were premature deaths. More importantly, this action put all our staff at risk, who are mothers of 2 children or parents. It was just, this report has vindicated everything we've said, that we were well prepared. It was the discharge of untested patients back to us. There were patients in hospital who already lived here. We asked for testing. They said it's not necessary. That the CQC and the Public Health England sanctioned this. They wrote off, they signed this piece of paper that said you can discharge from hospital without testing. Absolutely appalling.
So, David, what do you make of it when you hear, you know, we played those clips from Matt Hancock, from Boris Johnson, saying that they'd put a protective ring around care homes. How does that make you feel, bearing in mind the experiences you've had at your care homes?
Matt Hancock came here and visited, and you know, shook his hand, and he spoke to the residents, and all was lovely. I am still angry. I use the phrase, I went to bed angry, I woke up angry. It's that they didn't care. We are still second-class citizens. Healthcare workers can get antibody tests. Social care workers cannot. We're testing weekly. We're doing the best we can. We're still in shutdown mode. Visitors have to book an appointment to see. We're doing everything we can, but we still feel as though we are the neglected service.
David, do you feel like there needs to be more response to this from the government? Because in theory, I think you've lost 16 people from your care homes as a direct response, you say, from lack of testing that have ended up with COVID. And you're clearly still very angry and sound rightly so. What would you like to see happen? Do you think somebody needs to sort of ultimately pay by stepping down or having to leave their position? Because the decision to release those patients into care homes without testing has had a direct impact on the deaths that we've had because of COVID.
Senior executives in the Care Quality Commission and Public Health England and the NHS all sanctioned, and yet you don't need to be Einstein to know that you will get asymptomatic people in any virus. To discharge people without testing into a group where SAGE had already said this is a breeding ground or a potential breeding ground was criminal. Was criminal. People should be made to be accountable for what they've done. We are accountable to the CQC for every minute thing we do. Why are they not accountable for putting their name and their logo onto this piece of paper that said a negative test was not necessary?
Okay, Steve Webb, coming to you on this, former pensions minister. We heard Ros was talking earlier about having a more joined-up system that would be part of the solution as a way forward to solving some of the problems that have been going on for years over this. What, in your mind, do you think would be a way to alleviate some of these issues?
I would certainly agree we need to join health and social care together better. And there's no doubt we need more public money, more tax going in. The social care sector is too often treated as a second-class service, as you've heard. I think the other thing we need to do is help individuals who are worried about possibly facing massive social care costs, because some of us will face zero costs at the end of our lives, and some of us might face six-figure costs if, for example, we live with dementia for many years and have to be in a care home. And what successive governments have failed to do is come up with a way of all of us sharing that risk through some sort of insurance arrangement. So as with car insurance, some of us will have a terrible car crash, some of us will have nothing. We all pay into a pool, and those who have poor outcomes are covered. So I'd like to see tax breaks from the government. So if you wanted to use money from your pension pot or even a slice of the value of your house, and you would then be covered for all of your care costs, you could relax and your heirs and successors could get the value of your family home. Governments have shied away from tackling this issue for too long, and as well as reorganising in the way that Ros described, we need to look at the personal finances of this, which at the moment we're all at risk, you and I are both at risk of massive care costs later in life and no way of funding it really beyond selling our home.
Yeah, I mean, the government says that it's not a policy it's looking at the moment, but, you know, the issue is that something does need to be done to tackle this. David, let's come back to you again, because, you know, obviously we've had the situation that we've seen over the last few weeks and months, the pressures that have been there. We've got the warning this morning from Boris Johnson that a second wave might be on the way. What are your fears about how this will look, what might happen next when this second spike hits?
I think it's inevitable that second spike will come. We have not moved from our position of PPE, washing hands, masks, restricted visitors, and we will continue this, and we see this happening right through until spring at least. What we'd like to see is antibody testing for staff so that we get the same equality as National Health Service staff. I want to see this sector being treated as a proper profession. This is not the days of just people being cared for by unskilled workers have gone. These are highly skilled, MVQ trained. This is a great sector for people to come into. We need to start treating our elderly as any great society should. We're a great country. We should now look after our elderly. It shouldn't be an issue of second-class care for elderly.
No, and we couldn't agree more. In response to the report, a government spokesperson said throughout this unprecedented global pandemic, we have been working closely with the sector and public health experts to put into place guidance and support for adult social care. Alongside an extra £1.3 billion to support the hospital discharge process, we have provided 172 million items of PPE to the social care sector since the start of the pandemic, all testing all residents and staff, including repeat testing for staff and residents in the care homes for those 65 over or those with dementia. We know there is a need for long-term social care. We will bring forward a plan that puts social care on a sustainable footing to ensure the reforms will last long into the future.